Start.
Well, this is, okay.
We're good to go.
Okay. Hello, I'm Dr. Eric Bly, a family physician in Lethbridge, Alberta, and one of the founding members of what is now called the Lethbridge Newcomer Health Advisory Group. And welcome to Exploring the Lived Experience of Newcomers. This webinar is presented by the Lethbridge Newcomer Health Advisory Group, which is a working group of the Lethbridge Local Immigration Partnership, or LIP. This session will be recorded and will be available at a later time through a YouTube link that will be posted on the LIP website. And that website is lethbridgeimmigration.ca, all one word. Our audience will be muted during the presentations, but there will be a question and answer session at the end of all three presentations. If you think of a question during the presentation and you don't want to forget it, feel free to send it through the chat box, and Julia will make sure that it gets asked during the question and answer session. So we have three presenters today. Our first presenter, I just have to make sure this is right. We have Sita and then Olga and then Tina, in that order, yes? Okay. Our first presenter is Sita Kalikote, who immigrated to Canada in 2010 with her parents and her 4 siblings. She was born in Bhutan, but due to political unrest, her family fled to Nepal to seek asylum in 1992, giving up their house, their land, and their animals. Sita and her siblings were happy that they were able to attend school in Nepal, but living in a refugee camp was difficult, especially for Sita's mother. In 2008, UNHCR helped her and her family, plus 3 other families, start the resettlement process to Canada. It took 2 years before their file was finally accepted. They were very happy to come to Canada in spite of the hard times, as they made many adjustments, including culture, language, school, not to mention the cold weather. Sita's father had an especially hard time adjusting and became depressed. Sita was an interpreter at Lethbridge Family Services from 2012 to 2018. She has also trained and worked as a healthcare aide, and in January 2020, she took ownership of Danfi, a small Asian grocery store which also sells items imported from Nepal, including gold. She is the proud mother of a 4-year-old son and a 9-month-old daughter, and she is very grateful to have had the opportunity to come to Canada. So we will now turn the time over to Sita.
Hello, everyone. Again, my name is Sita Kalikote. As per Dr. Bly has already introduced me, like mostly cover everything, sounds like. So on top of that, like I will start from begin, like when I was born in Bhutan, my grandparents, they were like kind of very rich person, like it doesn't like sound like right now they were very rich, but they had lots of farm, they have lots of cows, goats, and everything. Unfortunately, the situation made them like they didn't have nothing. So we moved to like, they were like not planned to come to, but they were forced to leave, and they left Bhutan. And I was like kind of 8 years old when I came to Nepal, and it was really like we were very shocked, especially my dad, because he didn't understand what's going on, what was the situation that was happening at the time, like, and also because we didn't really know how to communicate with him because we were very small, and we tried our best to communicate, but it was hard for us because we were still small, that we couldn't explain to him that because of what the situation had happened in Bhutan. So finally the time went by, like, and then as soon as like even not an after a year, my grandfather got sick. He was paralyzed and he couldn't speak, like half of his part were like kind of gone. So it made so harder for us too. And we were like, we couldn't do nothing. We sent him to the hospital, and but like, because we didn't know what he has to do and what he can do, like feel him better. So the problems kept coming up and then more adding to him. So finally, like, he got sick, like 8 or 9 years sick. He was in bed. So though my dad, he was like disabled, he can't talk, he couldn't speak, but he was very helpful for his dad. He was taking care of him, taking to the toilet, because, and we made a small toilet because our in refugee camp, our toilet was like very very small. So even like if it's a very heavy person cannot didn't have enough room to stay in there. But we had made a small washroom for him. So my dad used to take him to the washroom, and he used to take care of him. So after that he died again. After that my mom, my grandmother, she passed away too. So kept the problems kept coming up. Like after that, actually we were, my sibling were like, including me, we were five. I my the older brother, like after me, the second one, my brother passed away. So we had like, can't imagine that the situation, what like happened to us, like felt like it's everything had on our head, like everything happened to us. And like, and I was the older one, and I was in grade 12 at that time. So I didn't have any choice what to do. So because whatever UNHCR were giving to us wasn't enough, so we had to pay the money for our higher education. The UNHCR, they were just supporting for us only for grade 10. So, and then I want to study more, but I didn't have money. My mother wasn't working, so because she, even if they're educated, they can't make more money, right? So she was staying home, and she was working. Though I think it's, I don't know exact word that's what it's called. She used to make a wool and then get some like 400-500 rupees and help us to get like run the households. After that I left school and I started like working outside. And I used to hide my identity because I wasn't from Nepal, because I didn't have citizenship and everything. I used to go very far from my place, and I used to make little bit of money for my family so I can help my brother and sister for study. So and then everybody, like I came home from my work, like I used to come like in a year like that, and I heard the some everybody talking they're going overseas, like different countries, they're helping the refugee to go. And I at first, and I was thinking to go to States, and I knew that Canada is really good country to go, especially for my dad and for us. So I file like fill up the form and just put it in the minister office, and then I again went for teaching. And when I came back, they called for us like interview. And after that, like I didn't go at like every months and months. So they called us and asked us. After that, finally we heard the noise that your file has accepted. So we are very very happy. And after that, like 2 years we planned. And but my dad didn't know that we are coming to Canada. He thought that we're going back to Bhutan because he was happy that he can do his farm, look after his all the cows and goats. And we kind of told him lie because we didn't have any option and we couldn't go back to our country. So we came to on the flight, and still he was happy. And when we came at the hotel, and he was like started getting mad, and he was really depressed. He tried suicide. He used to carry a rope, go around. And we felt like, oh my goodness, we why we did that. So after that, like even the immigrant family service, the immigrant service helped us so much, that because when he was very depressed. They used to come over our house, and they sent him to the hospital. Even he was on pills for like sleeping pills. And after that, we went to the immigrant service, talked to them, like, because his sister is still in Nepal, so they help them to bring them here. So after that, it little bit felt started getting better, and our life has started working. And so that's what how that's helping him to he started go to the DCAPO program, so he get engaged with other friends, and he kind of forget things. That's how help him to settle him down. Still he remembers because he has so many things, but like we talk to him, and he has a family now. Now he's like way better compared to the past times. And also I would like to what I'd like to give some, not the suggestion, but what I would like to share that, like, before when we come, like, everybody has to understand that what we are doing, like, especially I would like to emphasize, like, filling out the papers, like, because we came and we are excited to come to Canada. We didn't know, like, what are the paper we're signing, though they say, but it didn't come to us because we're like still a kind of small, or we're teenagers. So before we sign the papers, we have to be very careful that what we are doing. Like, the excited are on the one hand, but think that what's gonna happen when you come here. So the thing, my dad was like, he couldn't, when we come here, we were told that we have to pay the flight tickets and everything, but like we forget. After that, when we came here, we got the paper. Oh my goodness, like, we work, we paid, but I, like, for my parents, my mom, she doesn't speak English and she can't work. She was like over 60. And my dad, there's no point he's gonna work. So I tried to waive his the loan, and oh, government said, oh, you have already signed the paper that you're gonna pay for him. So it's like, oh no. So I would like to inform, like, before you, because everything has a choice whether you want to do it or not. So before you do anything, like, you have to read properly, or keep an interpreter if you don't understand. So make sure you do, like, you understand everything before you do it. So I would like to, like, um, give a share this thing to newcomers. And also because this country is really great, and even for the kids and for everybody, even for the older one, though it like, you have to adjust lots of things, but it's a great country. We are very happy, and everybody, my family, they're very happy, except my dad. It ups and downs, but it still has a very good life here. Even like in future, they're gonna have a very good life. Like, if I was in back home, or if I was in Nepal, like, I don't know how our, like, after we died, or even when we live, I don't know how our life would be like. Now I imagine that, oh my goodness, if I were in Nepal, so how would be we will be like surviving. Because if we now, every the time goes, everything get is expenses, and everything, like, we have to send kids to school and everything. Now it's when I start thinking about it, it makes me feel so worried. But now we are very happy to come to Canada, and my family, they were happy. And now I'm working. I also help my society here. I have a Buddhist community. I'm just doing I'm a vice president of my Buddhist community people. So I'm very happy to help my community as well. And I have already mentioned that I have two kids. Time goes like poof. I have two kids. I have a 4 years son and 9 months old daughter. So I'm very happy. So I think that's all from my side. Thank you very much.
Thank you, Sita. Dandiyabat. We will now move on. We'll have an opportunity to ask questions after everybody's given their presentation. So we will now move on to our next presenter, Olga Oleksandrivna Ogol was born in the Ukraine during the rule of the USSR. She moved to Canada in 2010 and will be celebrating her 10th anniversary here next month. Coming to Canada, she knew 2 words, hello and goodbye, and she attended English classes at both Flexibility Learning Systems and later at the Lethbridge College. Olga's husband was born in England, so immigrating to Canada was a very simple process for him. However, the same process took Olga and her son over 2.5 years. Olga was trained as a chef in the Ukraine, but when she came to Canada and saw how different the system was, she decided to try something new. She was an advisor for international students at the Lethbridge College in 2012. The following year, she was employed at Walmart and has been there ever since. Olga speaks Ukrainian, Russian, and English and has been a translator at Lethbridge Family Services in the Department of Immigrant Services since 2018. Olga is currently the co-chair of the Immigrant Advisory Table, which is a committee of the Lethbridge Local Immigration Partnership, a program although her settlement journey was a struggle at times, she's happy to have come here and is very proud to be a Canadian citizen. She feels that Canada is truly the land of opportunity and can't wait to see what more is in store for her. So we will turn the presentation over to Olga.
Hello. Hi, everyone. Thank you for presenting me. I just want to add that I came to Canada by my own will. Me and my family, we were looking for better life. That is the reason why we came to Canada. And I have to admit that life is much better in Canada than back home. In fact, after 4 years, when we moved to Canada, back home, it's started a war and it's continued till these days. Russia is fighting with part of Ukraine and especially with that part where I was born and where my family is living right now. My family, I mean my mom, my sisters. Our immigration process wasn't really difficult. The only problems we had, I would say, it's like miscommunication, because we were asked to provide documents which we didn't have, such as social insurance number. We don't have social insurance number in Ukraine. And when embassy were asking us to provide it, we didn't even know what they're talking about. And some documents, like a document to prove that my son is actually my son and I didn't kidnap him or anything. So only like small problems. It was very frustrating, but we did it and we came to Canada and we're very happy about it. And I want to share my experience. I thought only language barrier is going to be the problem, but I learned that as an immigrant, I have to start over, like pretty much like a newborn baby. I have to learn everything, even like how to take a bus, how to catch a bus. I was walking down the street and I need a bus and I wave. It's what we do back home. But the bus driver only waved back at me and smiled and he never stopped. I was disappointed, like why he didn't pick me up. And then later on I learned you need to actually go to bus stop at certain time and then you can use public transportation. I didn't know that. And how to call 911 and why you should call and when you should call 911, not just to ask to save your cat, like you can see pictures on the internet. And it was new experience. Also basic information like how can I help my community? I didn't know we have to clean snow on a sidewalk. We don't clean snow back home. It's nature. Today it's snow, tomorrow it's melted. We're not cleaning snow. Cutting grass. Some information about postal services. As an immigrants, we moved very often till we settle down, close to school, close to work. We're trying to find out better way. And I didn't know that when you move and you, of course, you change your address, you need to provide your new address like to your doctor, school, work, unless they ask you. I didn't know that. I didn't know that all my mail and important information keep coming to old address. So stuff like that, you need to learn. And of course, I want to mention Canadian health service. As much I understand and appreciate that we in Canada have access to very good health care, I learned that few problems exist, like family doctor. We do not have family doctors back home. I didn't know what family doctors mean, and the biggest challenge, where can I find one? How can I find one? Like, how does it work? How can I use this family doctor? No idea. Then, of course, I learned that, I don't know if it's Canada, Alberta, or just Lethbridge, has the longest waits for medical care. To see your doctor, like next day or same day, it's not gonna happen. You call today and your doctor might see you next week, maybe not. And of course, emergency room, you can stay there forever. And it was very shocking and confusing and disappointing at some time because it's totally different from back home. And like I say, even though Canada has the best medical care, this kind of problems was frustrated. My son, he's 24 years old and he's a soccer player, and he has very bad knee. He had accident while playing soccer. And we were waiting 14 months just to get to CAT scan, to scan his knee and see what is going on. 14 months. I was very frustrated. I thought in 14 months he can lose his leg. Like, why do we need to wait that long? I couldn't understand. I still don't understand. And it's been already 3 years. We are still waiting for surgery. We're still waiting for this call to get surgery for his knee. So I'm happy in Canada, and I'm happy with service, but some issues I don't understand. And also, as a newcomer, I didn't understand about medical coverage because we do have Alberta health card, and we already have coverage. But people keep saying, like you can hear, you need a Blue Cross coverage or you need any other coverage. And I thought, even when I'm sick, I didn't go to see doctor or I didn't go to hospital because I know I cannot afford it. I don't have coverage. And only later on, I learned that I do have coverage. This card they give me, it's my coverage, but nobody really explained me how to use it and when to use it and stuff like that. So yeah, again, like I said, like a newborn baby, I need to learn everything by myself, and I need to just go and ask and find out. And of course, yeah, it's up to me. Nobody gonna bring it to me. I understand. Nobody gonna come knock on my door and say, you know, you should do this and this. But I think service should be more. Even when I receive this card, people should explain more about it, because we don't do it back home. We don't have any coverage like this, and it's totally different. So turn out the language barrier wasn't the biggest problem for me, even though I still have big accent, heavy accent, people usually say. But yeah, and some people very patient with the language barrier. Some people will point at you, but in general, not too bad. And what else I wanna add? And yeah, I'm very happy to be in Canada, especially like I say right now, because we have war situation. And I also wanna add, I'm going to divorce right now. I came to Canada with husband and son, but we're divorcing. And again, you would not believe how much I need to face and learn about how people get married in Canada. I was married in Ukraine, and how people getting divorced in Canada. It's a new chapter in my life. And again, I need to go and find it myself, what to do, where to go, how. And because I'm an immigrant, every question in my head, I'm asking, oh, it's not like back home. Oh, it's not what we do back home. I'm in Canada now, and I think people do it different in here. So it's different for me, very different, but I'm very happy that I'm here, and whatever is happening to me, it's all good. Thank you.
Thank you, Olga. Again, we'll hold questions until the end of the last presentation. So we'll move on to our third presenter. Tina Azimi was born in Kabul, Afghanistan. Tina and her family of 13 moved as refugees to Iran when the Taliban conflict began and lived there for 7 years. When Tina's father passed away, her mother applied to emigrate to Canada in pursuit of a better future for her and her 11 children. After 1 year of waiting for approval from the International Embassy in Tehran, they were able to move to Canada. Arriving with no educational background and zero familiarity with English, Tina and her siblings blended in with the Western lifestyle as time passed. Tina graduated from U of C with a bachelor's of social work and a diploma in psychology. The journey was hard and challenging for Tina and her family. Some of the challenges they faced were learning about and adapting to the culture, the food, language, and the changing climate. Although Tina and her siblings have adapted to their new home, their mother is still struggling a lot, especially with the language. The highlight of Tina's journey to Canada was when Tina's mother announced that they would be moving. This was exciting news, even though it came with an unsettling feeling. Tina currently works as a settlement practitioner at Lethbridge Family Services in the Department of Immigration Services. So without further ado, we will pass the time over to Tina. Tina, you are muted. Still muted. Can anybody help Tina get this figured out?
So you are unmuted, so it's got to be a sound, something with the sound system. Can someone from Lethbridge Immigrant Services see if there's something you can do? Thanks.
Maybe we should take a few questions for Sita and Olga while we're waiting. Do we have any questions from the audience for Sita or Olga? I have a couple of questions here. Sita, what do you remember about your trip from Bhutan to Nepal? You said you were quite young. Were you traveling by car, by bus, by plane? How did you go from Bhutan to Nepal?
Yeah, I remember that we came to the big truck because they didn't plan to leave. So they're kind of hiding and coming. My grandfather has booked a very big truck, and they put everything on the back of the truck and all his stuff and everything. And all my 5 siblings, including me, my parents, my uncles, my aunties, and there's almost like 14 people. We came on the big truck. We came till like to Takarvita and in Nepal. And again, I think they took a bus to come to the another city.
How long did the trip take overall?
Uh, I almost forgot, but
You
probably
were pretty
took us
little.
like 3 till to India. Maybe they took like a week because they stayed in India for like few days.
And what time of year was it when you arrived in Canada?
We arrived in 1992.
What was it? What season was it?
Sounds like it was summer season. It was like
Okay.
long.
You weren't too shocked. You didn't come in the middle of winter.
No, we didn't come in the middle of the winter. It was sound like it wasn't very, because my place was kind of cold, and when we came, it was very hot. In Nepal, it's like crazy hot. So when we came, it's still. I think my mother told me we came in February. I remember now. It was kind of cold, but still we feel so hot because we came from very cold place.
You mentioned that you worked a little bit outside the refugee camps, but you hid your identity. How were the Bhutanese refugees treated in Nepal outside of the camps?
Because they had, because in our refugee camp we only had English, so we didn't like, we only have one subject Nepali. But in Nepal, in the they were like kind of English medium school, but lots of people they don't speak English. But so I was finished grade 12 and I went to the villager side Nepal, because they didn't like it, because the people from Nepal, they didn't get a job, because they were kind of jealous because we were giving us all the sources, like we have rice, vegetables, everything. Those people were thinking because we have already everything, so they think that they didn't have a job. So because of us, they don't have a job. So they were kind of jealous. And also in I don't know why they think in that way, but if we say that we are from refugee camp, they didn't give us really good like salary. And also like we were very discriminate. And at first they will ask that, do you have are you from Nepal, or do you have certificate, something like that. So that's why I was like, and I don't, nobody wants to be discriminated, right? So like nobody wants to humiliate. So that's why I was hiding. I told them that I was from India, and I like I was teaching the small kids, so I used to hide them. And it was very sad. They asked me, because they were trying to find me where I was from. Why did you, because I didn't have a mobile or anything. And they used to ask me that, why didn't you phone your parents, or why didn't you phone anybody? They were trying to like make me like evacuate everything that I was from. They were just they were in doubt, but they didn't exactly say that I was from refugee camp, but they were trying to ask and like make me to tell them. So that's why I used to hide everything. That's why if they want to know like I was from refugee camp, I used to, before they know, I used to leave the place, and I used to go other place to do the same job.
So outside of the refugee camps, the Bhutanese refugees were not treated well in Nepal.
No.
Okay. Do we have other questions?
I would like to like just like not all the people they don't treat like that, but mostly they were because I had that experience. So because I felt like, oh, they were doing that, but not everybody, but most of them.
I did write a question, but I can verbally ask it if you want me to.
Yes, go ahead.
Yeah.
Sure.
So Sita, this question's for you too.
Okay.
You own your own business, right?
Yes.
You own the grocery store?
Yeah.
So how long were you living in Lethbridge before you owned your own store? And did you face any kind of obstacles to being an entrepreneur here in Lethbridge?
Yeah, I've been like last July. It's been 10 years that I've been in Canada. so it's just before last year, like I started from last year, but I was in, like I was doing in partner. My partner, he left, so I started new again from January. Yeah, there are lots of challenges to do it. So the first thing, because I got a license for the food and inspection, something like that, and I from states, and I got all the items, and from here, the one of the lady from the government, they came, and I have to have, I didn't know that, and because I have to have both in French and English. And I was like, the lady came and see everything. Oh, you have to do this one, and you have to do the lab, something like that. Oh, and I thought that, oh, I didn't know that, because when I got a license, I didn't know everything. So that's why before I was mentioning, before anything we do, let's make sure you read everything and understand everything. And after that, I canceled my license, and I told them I'm not gonna do it because it takes lots of time, and I don't know French and anything. So that's why I had to cancel my license, and I just got the shipment from other place, other provinces.
Okay, I think Tina is ready to go. So we'll turn the time over to Tina, and then we'll still have a question and answer session afterwards.
Hi, everyone. Can everyone hear me now? Okay, good. Finally. Thank you for waiting. First of all, thanks for everyone being here with us. And I would like to pick up from the second last sentence of my biography, the part where it mentions that I was excited, but yet there was unsettled feelings that creeped in my body. When I was writing this, I was struggling to find the right word to describe this feeling because I couldn't find a fixed terminology for it. But I would like everyone here with us today to take a moment with me and understand this feeling. So if we can all take a moment and just go back to a time when you had to move. I'm sure everyone here at one point had to move. So now let's think about that moment and think about how old were you? Was this move by choice, or was there a force that caused the move? Did you maybe move from one part of the city to the other part of the city? Or did you move from a province to a province? Did you move from one city to another city? How big was this change or this move? And when you moved, were you given a choice? Were you given an appropriate time frame? And when you moved, did you take all your belongings, or were you only allowed a small suitcase to pack? Now think what it would be like to hear a sudden news that you and your family are moving, not to the other city or to the other side of the town or the next province, but to another state, miles away from what you call home. And you are only allowed just a small suitcase to pack. So what do you pack? And how do you pack the important things in your life, like your friends and your extended family? When migrating and leaving your friends and extended family and your belongings, on its own can be traumatic, let alone going to a different environment, a new environment that you are unfamiliar with its culture, language, food, and norms. I hope now you understand why I can't find the right word to express, because it is a mixture of feelings that with it comes layers of challenges and barriers. You can almost say that these feelings can be frustration, anger, stress, or even excitement. Even excitement itself is sometimes nerve-wracking. Now that we have an understanding of how it feels like to move, maybe if it's by choice or even not by choice, when you're migrating, when you become a refugee, most of the time it's not by choice. It's being forced to move from one place to another to seek safety and to seek better future. And that's what my mother was thinking when she decided to move. She wanted a better future for her kids. And so I would like to discuss some of the challenges that not only my family faced, but refugees in general face. And these challenges are mainly, I'm talking about where we were in Iran. And then, yeah. So when we moved from Afghanistan to Iran, I was pretty young, but I still remember a lot of it. The challenges that we or my family faced were mainly related to education, healthcare, employment, and housing. When my family lived in Iran, we didn't have opportunity to access education. Education was not a right, it was a privilege. And if you were not born in Iran, and if you didn't have the residency card, then obtaining an education was very hard, almost next to impossible. Unless you could have afforded private schooling, in which most of the time, if you did afford it or could afford it, you got bullied in it. I remember when I was 8, and we didn't live that far from a school. I remember watching girls my age or close to my age walk towards the school wearing their school uniforms and backpacks, and I would often wonder, why can't I be like them? And most of the time I felt anger, but I felt it towards my mom because I blamed her for putting us in this situation. And then that's most of the time, that's the feeling that you feel when you're at a place where you are violated of your rights. And then the next thing that I would like to discuss is the healthcare system that we needed to access in Iran. Healthcare system is not so well, especially for the refugees. You had to either buy a healthcare package or pay upfront. And if you wanted a better deal, you would buy the health packages or the health insurance. But not even that was affordable. And if you didn't have that, and if an emergency came up, then you would have to pay upfront. And if you couldn't pay upfront, oh well, it didn't matter what triage you were in. You couldn't afford it. So you would have to go back home or try to come up with the money. And this was something that my family faced because my father passed away from health conditions. He waited for a while to get in the hospital, but we managed to get funding from UN, the United Nations, and so he was able to get into the hospital, but unfortunately we lost him because he had a heart surgery that didn't go well. So the health system was very challenging, and I could imagine that it still is challenging for a lot of refugees to access in Iran. The workforce was the one that was well, healthcare is the most important one, but workforce is something that you need to survive on daily, or employment is something you need to survive on daily basis. There was no age limitation for work. Here in Canada, you work. Some places won't hire you unless you're 14 years or older. But in Iran, you didn't have to be 14. You could be 10 or 9 or whatever age you needed to be, as long as you were at the capacity where you could move forward with employment, which most of the time was around 9. And I remember seeing little kids working for local grocery stores at a young age because they either had a single mom that was not educated to find an actual job, so they had to provide food for them. And then also there was work for women, but there's 3 main jobs that they did. They either beaded bridal dress, they caned sugar, or they cracked walnut. How exciting. And they made very little, $3 to $5 was what their wage was. So you can imagine the challenges with that, especially if you're a single mom with 11 kids on your hands. And then housing, I just want to talk about housing also because that's also something that we need wherever we are or anywhere we are. We need that. Everybody needs a roof over their head. The only reason why Iran doesn't have a refugee camp is because they want people to rent the houses. They want them to pay, and that's a way. That's one way. It's a way of the landlords making money. And the housings are not affordable. They're very expensive. And so these are the challenges that my family, my friends faced, and I was pretty young, but indirectly I was affected quite a bit. And so, but moving to Canada, it changed everything for us. So we are thankful that we're here. We're thankful that we're given different opportunities. And before migrating, life was hard. Life was challenging. Your human rights are, and my rights were violated consistently. My family did not have a role model because my dad passed away. And it was so hard for my mom to provide for us. I remember how hard it was for her to not be stressed, to not show the stress, to pretend like it's all good. I remember as a child, I would help my mom and my older siblings with their jobs so they can finish faster, so they can get paid, and so we can have money, so we can have food on the table. I wasn't worried about playing with the other kids in the backyard or in the alley. I was worried about our safety and survival. My mom and my siblings, they also beat dresses. So I would help out whatever ways I could. So looking back, life has changed quite a bit and drastically, which I am thankful for. I know that my mother is still struggling here in Canada with the language mainly, but she's also very happy that she doesn't have to worry, she doesn't have to consistently worry about providing food for her children and keeping them safe. So overall, it's been a great experience moving from Iran to here. Here I was able to access education. I have a degree now in social work. I have a stable employment, which I am thankful for. And there was challenges on the way, but as you move forward, these challenges get easier. And I figured that it has a lot with your age. The younger you are, the easier it is. The older you are, the harder it is. So I'd like to discuss about a couple of challenges that I faced or many immigrants face when they move. At the beginning, a lot of my challenges in my settlement journey was due to my language. Not knowing the language is very hard. It feels like you are living with a disability. It feels like you have been muted, and it's sometimes when you want to express something and you can't, this may be a bit of a literal description, but literally you feel like someone's choking you. I went to school not having friends because they didn't understand me and I didn't understand them, which is not their fault. But I would, an advice or a suggestion that I would give for any parent out there and any adult is to have an open conversation with their children. Let them know that there are kids that might not be able to speak their language. There are the kids that might not be able to understand them or them to understand the kids. But it doesn't take a language to involve your peers in your social circle. So that's something that I would put out there for a lot of adults. And then another issue that I find is within the healthcare system in Canada, it's a great system, even though there's a wait list for it. but I'm so thankful that we can access it. It's got a lot of greatness to it, right? It's free, it's accessible. Yes, there's a wait line, but the positive side is it is available. But one issue that I see or continue seeing is that the healthcare system is not really friendly user when it comes to not knowing the language. It is super hard when you don't know the language and you have to walk into the hospital. When you walk into the hospital, the only interpretation is available through the language line, and not many departments have access with it. And this is coming from my experience through work. It's great that there is at least language line, but it makes it so much harder when you have communication over the phone, because communication is not just by words. It includes your body language, eye contact, and the emotions that you show. So that's something that I find challenging with the healthcare system here in Canada, for immigrants or refugees at least, is that the accessibility to interpretation. And then another thing that I find challenging, like even myself, I find challenging, is like when you go to the registration desk, when you want to go to a certain department, like yesterday I was there, I'm like, I need to go to the lab. How can I get there? I'm given a direction, which was super awesome, but it wasn't helpful. I was told to go down the hall, go right, and then when I turn right, I turn right again on the first right on my right hand. And then I turn left, I should go straight, and I should see a sign where it says lab. Okay, that's not hard at all. Let's do that. I followed the direction, but instead of getting to the lab, I got to the respiratory unit. That's not where I want to go. This made me think, it allowed me to think for a moment. Well, I have the language skills. I'm educated here. I couldn't find the direction. What would it be like for someone like my mother if she walked in there, if she couldn't follow those directions? How hard would that be for her? So that's something that I find challenging. That's just maybe it was just my experience, but I have witnessed it multiple times. And something else that I find challenging is that not everybody is culturally sensitive. I think that the community should be more aware of cultures, and that if there is some sort of cultural sensitivity training in the community within the professions, that we're aware of all of this. It will help us to better understand our clients. It would help us to better our services or tailor our services to meet the needs of the clients. I think overall, when you're moving from one place to another place, like at the beginning I said, whether if it's moving to the other side of the city or to another province, can be very challenging. But if there are people in the community that understand you, that have services that are tailored to meet your needs, and they're sensitive to your needs, then it can be so much better and so much smoother. Thank you.
Thank you, Tina. So at this point, I guess we'll just see if anybody has any questions for Sita, Olga, or Tina.
I have a question for Tina. So just to be clear, in Iran, like you mentioned, it doesn't matter what triage you're at. Unless you have the money, you're refused treatment?
Yes,
is that correct?
It is correct. Like we had this experience with my dad. He had a lot of mental health issues, and then with that, he may have not made right decisions in life. He didn't make right decisions in life, so he had a kidney failure, a couple other things. He had to wait for some sort of money to come along to get his help. So it is, yes, it's not accessible unless you have the money, or you can find, I would say donation, or yeah, donations would be the right word, I guess. And then which we had to do, we had to find donation, and the United Nations does help out quite a bit with that.
So if somebody presented, say they had a, just to reiterate this, so your father had chronic conditions, but even in the case of an emergency, an accident or something like that, they send people away.
They would give you the help, but you are going to get a large bill.
Okay.
So it's your choice. It's your choice. Do you want to go in? You pay thousands of dollars, or you walk away. Right? Like they do give you that choice, but you're gonna choose. So if you are in a situation where you can't provide your family food, what are you gonna choose? Are you gonna choose to rebuild thousands of dollars, or are you just gonna go home? It's that sort of thing. You know what I mean?
Yep. Your health or your rent.
Exactly. Yes.
Yeah.
And I'm talking about like 15 years ago. I'm really hoping that it's not the same. I have not checked in yet.
Thank you.
I have a question.
Go ahead, Santos.
Right. Hi, Tina. Thank you so much for sharing your story. It's very touching. You know, being new to the country and coming from different cultures, it's always very, very difficult, especially for our parents, because for us, it's easy to catch on to this stuff, but for parents, it takes really long time. My question to you is, does your mom ever regret coming to Canada? What I'm trying to say with this question is that, does she feel like if she had more opportunity to go to school, if she had some fundings or some sort of help to look after her kids, when she could have continued going to the school to learn language, does your mom think that she would have been better off, or she would have been better than what she is right now?
Okay, thank you for that question. That's actually a really great question. My mom would have loved to stay home back in Afghanistan because her parents are there, her siblings are there, her friends are there, right? Who wants to leave all that behind and come to a place where you're unfamiliar with? So if she had the choice, she would have definitely stayed, because here, she's depressed because she doesn't know the language, she doesn't know anybody in the community. There are a couple of Afghans here, they're amazing, but it's different, it's totally different. And so if things were better for her, she definitely would not have came here. She would have definitely stayed where she was familiar with the language, the culture, the food, everything. Because like I said, the younger you are, it's easier, but the harder you are, it is so difficult to adjust. And some people don't adjust. Like my mom, she hasn't still adjusted yet, but she's thankful that she's safe and that she's got food here. And like you're saying, if she had those back home, I'm sure she wouldn't have made the choice to move drastically from other side of the world to this side of the world. So yeah, I hope, does that answer your question, Santos?
Yeah, sure. No, thank you. It does. Yeah, for sure. No, it's just like in your view, do you think your mom was given opportunity to better herself when she came here, or was she had to go to work to look after her kids?
Okay. I know, honestly, she was told that she needs, after, when you come here the first year, you are getting funded through the RAP program, and then after that you are kind of pushed to find employment, you're pushed to learn the language, to find your ways in the society, to settle or integrate into the society, right? So she did have to, but luckily she had us, her kids, there's 11 of us, so we are her support system for a majority of the time. And so because she doesn't have any work experience, we didn't let her work. I worked when I was 14 when I got here. My first job was at McDonald's. I went to school and I worked so I can help my mom out so she doesn't have to do something that she's never done in her life.
She's very lucky to have you as a daughter.
Thank you.
Thank you for sharing your story.
Any other questions?
Can I ask a question?
Go ahead. Yep.
This isn't a question for any one presenter, but for all of the presenters. I'm just curious if anyone has had any experiences with the healthcare system that they feel like either went really, really well and they could kind of put their finger on what that person did that made that experience good for them, or any sort of experiences where they think, oh, if only that person could have done this, it would have been a much better experience. Just some practical things that we could take from that.
So Sita, Olga, Tina, anyone feel like responding to that question?
Sure, I can add to that question. I can give Dr. Bly as an example. He's gone above and beyond his role as a family doctor to help support newcomers in this city, I would say. I can't talk about everyone else, but to the people that I know of and from what I've heard from my community, he's always been very, very helpful, caring, and he's gone beyond his role to help them, to understand them, and to care for them. So definitely Dr. Bly comes to my mind all the time when we're talking about someone who's done more than his own responsibility, I would say.
Thank you, Santos. Anyone else have experiences with the healthcare system they want to share, either good or bad, especially if you can think of ways that individual people could have either made that experience a good experience or could have changed that experience significantly?
Tina, your experience with not being able to find the lab, it just made me think, like, I was at Children's Hospital with my son, and they have a wayfinding service there where they kind of show you where you need to go if you don't know. And I thought, well, that's really cool. I bet you a lot of people could benefit from that, but I've only ever seen it at the Children's Hospital. So that was just one example I thought of while you were talking about that, Tina. Thank you.
Yes, I was actually going to talk about that too. So if the hospitals could have some sort of that, I know in some places they do have volunteers for that, where if somebody needs something or if it needs to be directed somewhere, where people will actually walk you there instead of say turn left, right, and then left again and then left again, which is like, whoa, okay, you got me lost at the first right. So if there's some sort of services like that, that would be great. But there are a lot of amazing individuals in the community, like Santos said, that do go above and beyond to meet the need of their clients, and they try to understand them, which is amazing. And those people do exist. And there are small things like the language line actually is something that I wish. Not the language line itself is great, but I wish there was in-person interpretation in the hospital. That would help so much with a lot of things, whereas in over the phone, a lot of things can be miscommunicated, or the communication can get lost, or maybe the person can't get hold of that person over the phone. As some departments have actually said that they don't have access to it. So the language line is, or the interpretation in the hospital, something would be that could be improved or could use some improvement.
Yeah, that's something our group has been aware of and has been pushing for, is better language services in the hospital. Olga, I have a question for you. You mentioned that you don't have family doctors in the Ukraine. So what would you do when you had a health problem? How did you know where to go? Olga, are you still there?
Hello, can you hear me now?
Yeah, go ahead.
So in Ukraine, if you don't feel well, you go straight to the hospital, not emergency room, hospital. And at reception desk, you explain to person what's wrong with you, like how you feel, like it's something with your head or with your arm or with your stomach. And doctor send you straight to the specialist. It's a lifeline. Sometimes you need to wait 5 minutes, sometimes maybe hour, and you're gonna be seen by specialists right away at same day. Uh, they might not help you because we don't have very good equipment and medication, but you will know what's wrong with you and what you can do if you have money and you have some sources to help yourself.
And so how did you figure out how to navigate the system here when it was so much different?
Well, like I mentioned before, when I wasn't feeling well, I didn't go to hospital or emergency room because I was afraid I'm not covering for it and I didn't have money. And then listening stories from my friends and neighbors and coworkers, I realized I do have coverage and I need a family doctor. And again, I asked, what is family doctor and where can I find one and stuff like that. And then one of my friends, she said, if you want, I can ask my doctor if she's taking new patients. So she did ask, and her family doctor took me. Now she's my family doctor, and I went to see her. But again, I didn't know I need to book an appointment. So I did book an appointment and I went to see her, and now I do have a family doctor. And I know I cannot just call her anytime I want. She's not my friend. She's just a doctor who's gonna help me. And yeah.
So you just had to figure it out from friends and neighbors and just piece it together.
Yes, yes.
Okay, thanks. Any other questions?
Hi, I work in the field of education, and I guess the question that I have is about the psychological impact that Sita shared about her father and Tina shared about her mother. And I'm just wondering, I guess we often assume that families are just so excited to be here that we don't really take into account the psychological impact that they've had. So is there anything that you could say that we could do to make things better that would have changed the experience for your father, Sita, or for your mother, Tina?
Just, now I think it's okay for my dad. He's because now he's very happy because he has his grandkids. Like he forgot like most of the past things, and because he whenever like he's sad, he'll go around and he watches his grandkids, and he's after that he get relief and he's happy when the grandkids started talking to him, so he's happy. And my mom is always happy because she wants to see his kids progress. Now kids are happy and mom is always happy. So, but thank you for asking. But yeah, they're happy now. Even my dad, he stopped going to Decapo, and my brother, he has a little guy. He has a son. He's like 5 months old, and he loves. It's still in his head because he wants the son. He loves the son. So it didn't mean that he hates the daughter, but he likes sons. So my brother has now son, and he loves. He stopped going to Decapo. He looks after him. Even he didn't let him to cry. He carries all day.
Thank you. Anyone else care to comment on any?
Yeah.
Go ahead.
So I just wanted to answer Delphine's, sorry if I'm saying your name wrong, Delphine's.
Daphne, yes, thank you.
Daphne, sorry. Okay. So I just wanted to add to that. If I believe that if there's mental health services here available that focused on those experiences for refugees like homesick or, you know, sort of like a, I guess I shouldn't say fever, but it is sort of like a fever that you carry on, but nobody addresses it. So if there was somebody that addresses it, other than the mainstream counseling that we have, which there's a huge wait list, I think that would be very helpful. So that's something that I would think that would help my mom. Other than that, maybe if there is, yeah, community resources would be really helpful.
It's resources dedicated specifically to helping newcomers as well. Is that?
Yes, that's exactly what I mean.
And dedicated mental health for newcomers.
Can I add something? I want to mention that I've been in Canada 10 years, and my mom, she never visited me, and I don't know if she ever gonna visit me as much as I want to. Her excuse, what I'm gonna do there? I have no friends. I cannot speak English. Cannot even go shopping by myself. Like, she's terrified to just come visit me, not even live with me. And I was wondering if for newcomers, we can come up with something like a social club or some kind of support group for elderly people where they can gather together once per week, like to knit together or to dance or just to speak or just to cook. I don't know what elderly people can do together, but something to like a senior house, but activities kind, but for people who have family, like, no, they don't need to stay in a senior house, just to come and make friends, even though they're from different countries. And because some of them, they old, and it's very difficult to learn language. It's a big challenge. But maybe by doing something, by making friends with limited language, it will help. It will help with depression and just with their life in general.
We do have an example in Lethbridge of a seniors group that did quite well. There was a Nepali speaking seniors group that I'm not even sure who formed it, but that was a good example of something that did help that group. So yeah, expanding that to other populations would be helpful.
Yeah, it was formed through immigrant services. So we did it for a number of time, and we also had a community garden through the seniors run at that time, and it was something that they really appreciated.
Any other questions?
We just have a comment in the just in everybody section. It's just as a newcomer immigrant, I had the best experience of having a good family doctor by learning about my background as a refugee, not only focusing on medical aspect of it, but also social aspect to better understand me as a patient.
Excellent. Any other comments or questions?
I also had some come to my my comment box, but it was just mostly great presentations. We learned a lot. Thank you for presenting. So I think there was a great appreciation for the stories that we heard today and the struggles and also the good things.
Definitely. We're very grateful for those who share their stories. And we know that there are many other stories out there that still need to be shared. Just a reminder that this presentation has been recorded and it will be shared on the Lethbridge Local Immigration Partnership website, which is lethbridgeimmigration.ca. It'll be a YouTube video, but the link to that video will be shared on the Lit page. And feel free to share that around. Any last comments before we close? Stasha, do you have anything you want to say?
I just would like to say thank you to all the presenters for sharing your story. We very much appreciate it, and I think have a lot to think about and reflect on how we can do better within the health system, but within our community to support newcomers as well.
All right.
I just
Well,
want to
thank you.
add,
Oh, go
sorry,
ahead.
can I add something? Thank you to Sita and Tina and Olga. And I wanted to share that I knew Olga and Sita earlier in their settlement, like very early, as well as some of Tina's family or her siblings. And it's just amazing to me to listen to your stories and to have watched you over time and your settlement and how you've integrated yourselves and have been such warriors. And it's just amazing for me and my privilege to have watched that journey. So thank you. And thank you for sharing that today.
Thank you.
Okay, I think with that, we will call an end to this webinar, and thank you again for participating, both as presenters and as an active participating audience. So thank you very much and take care.
Thank you so much.
Thank you.
Thanks, everyone.
Have a nice day, everyone.
Thank you, everyone.
Bye.
Thank you so much. It's lots to say, but but yet we have to work on time too. So yep. Thank you so much for letting us to share our feelings.
Thank you for sharing. All right, bye.